Welcome to the 5th Annual Brooklyn Stroke Symposium, jointly sponsored by Maimonides Medical Center, Neuroscience Institute, Department of Neurology, and SUNY Downstate Health Science University, Department of Neurology. It's my pleasure to welcome our beloved Chair of Neurology, Dr. Danny Rosenbaum, and distinguished Service Professor of SUNY Downstate Department of Health. Please go ahead, Danny, to give us the welcome remarks.
Okay, well, thank you, Tony. Again, I just want to reiterate Tony's welcome to everybody to this 5th Annual Stroke Symposium. As of last night, my understanding there were greater than 900 registrants for this symposium, which is an all-time record, not only for the symposium, but I think for all CME events at Maimonides. It reminds me when I was a resident, the adage was for neurology, it was diagnose and adios. We had very little to offer our patients. And for stroke in particular, all teaching rounds consisted about arguing whether we should put a patient on anticoagulation or not anticoagulation, and maybe to send them for carotid endarterectomy, and that was it. This morning is a reminder to me that the field has advanced dramatically. We have wonderful outside speakers as well as outstanding speakers from within the institution to tell us how far stroke therapy has advanced over the past several decades. And it's a delight for me to, continually get educated. Finally, I would like to thank Tony, who has been the person who really has spearheaded this symposium, and it really is one of the highlights of the academic year for our department and from the institution. And it's also an opportunity to thank him for his leadership for running the Jaffe Stroke Center at Maimonides. So thank you and welcome, everybody.
Thank you, Dr. Rosenbaum, for your kind welcome remarks. It's truly a pleasure and honor to have the opportunity to serve the community, to work with leadership like Dr. Rosenbaum and Maimonides administration leadership and SUNY Downstate to support our academic neurology endeavors, including clinical care and also research as well as medical education. So in May every year, we gather here to celebrate the National Stroke Awareness Month and to mark the progress of our program and also to share the collective advancement that we achieved in the past year in the field of stroke neurology. Maimonides has been one of the largest standalone community teaching hospital with tertiary care capacity in the country, carrying the community for more than a century. We have terrific physicians and expertise and dedicated staff providing the top-notch care to our patients. And we have been very proud of our program's transformation over the years, staying at the forefront of stroke care and the stroke research. Today, we're very lucky to have an amazing lineup of speakers, many of whom have international and national renowned expertise in the area of this discussion today, along with many local experts, outstanding experts to give us an overview of many interesting topics. The overarching scheme of this year's symposium is the unknowns, the rarity, and also the controversies. The topics we will touch upon today, including stroke in women, children, and people with migraines, and also cryptogenic stroke, in addition to stroke in the retina, as well as in the spinal cord. So these are rare conditions compared to the typical, brain strokes, but they are critically important because they are very much devastating in terms of patients' functionality. So we'll hear about these things. How do we triage and manage and treat these and preventing them? In addition, we'll hear about the brain and the heart interaction as a two-way street, and also our brain-heart initiative that's active at Maimonides for years. Our collaborative efforts between our cardiology colleagues and also CT surgeons. In addition, you'll hear about topics like carotid revascularization. What's the cutting edge paradigm right now for treating a old disease that actually is evolving in terms of treatment modality and methodology? In addition to subdural hematoma, what's the latest treatment paradigms? You'll hear from all the speakers. So I look forward to hearing your feedbacks and questions, and I hope you'll find these discussions, presentations informative, inspiring, and enjoyable. I want to thank a special thank you to our program coordinators, Betty Bremen. Can you wave your hand, Betty, in the back? And Rena, who's Betty number 2. She's out there registering patients. She'll be our future coordinator after June. Betty is moving on to bigger and better things in the near future. But she has certainly made a tremendous mark and legacy at the Maimonides stroke program in the last 4 years. I also want to thank all the speakers for taking our time out of a busy schedule, preparing the talk, and come to share with us your expertise and your knowledge to help us to help our patients better collectively going forward. Lastly, I want to thank the administration for the very strong support, continuous support, so we can proceed with our stroke initiatives collectively. In the end, I also want to thank our patients and their families for their trust in us to take care of them during the most vulnerable time in their lives. So thank you all.